Good morning, everybody. We're here for the Health and Human Services Committee meeting this morning. Madam Clerk, would you please call the roll?
Alderwoman Ingracia. Alderwoman Spencer.
Present.
Alderwoman Tyus. Alderwoman Green.
Present.
Alderwoman Martin.
Present.
Alderwoman Navarro.
Present.
Alderwoman Middlebrook. Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairman Arnowitz.
Present.
7 present, you have quorum.
Thank you. And the first thing we need to do is approve the minutes from the January 16th meeting, 2020.
I move that we approve the minutes from the January 16, 2020 meeting. Second.
And Madam Clerk, would you please call the roll?
Alderwoman Ingracia. Alderwoman Spencer.
Aye.
Alderwoman Tyus. Alderwoman Green. Aye. Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice. Aye. Alderman Todd. Aye. Chairman Arnowitz.
Aye.
7 aye votes.
Thank you. And the other alderpersons are excused because they're necessarily absent.
So noted.
Thank you. Good morning, and thank you, everybody. This morning, we're here to hear Board Bill number 199, and the purpose of this bill is to put back in the ordinance what was taken out some years ago. Dr. Eccles and his team has done some research on it, and we want to make this as part of the health component again. So, Dr. Eccles, I'm sure you can explain this better than I can, so if you don't mind stepping up.
All right, good morning, Board of Health and Human Services. As Chairman Arnowitz mentioned, the purpose of Board Bill 199 is to commemorate the re-designation of the Department of Health, the City of St. Louis, as a health care component of the hybrid entity of the City of St. Louis. The city has been designated a hybrid entity pertaining to the Health Insurance Portabilit and Accountability Act of 1996, designating the Department of Health as a health care component by amending Ordinance number 68109, commemorates the determination by the Director of Health that the Department of Health, as currently operating, is a covered entity as defined by HIPAA. And so typically, so there's certain criteria that an organization must have in order to be determined a covered entity under the HIPAA Act, which was designated in or passed in 1996. So there are typically 3 categories. So one is a healthcare provider. So you have your primary care physician, specialists, psychologists, mental health providers, et cetera. And the health department, over time, the clinical services component of the health department those were cut. So we don't provide a lot of direct services, but we contract out with organizations such as Washington University and other agencies in the health system to provide healthcare services for City of St. Louis residents. A health plan, we don't operate as a health plan, but we do operate as a healthcare clearinghouse. So through our surveillance efforts, we obtain data from organizations such as the local hospitals, health systems, dental offices, laboratory providers, et cetera, and they submit their information to the health department as part of our surveillance, and then in turn we package that information and standardize that information and submit it to the Department of Health and Human Services. And so under this category, the department has been operating and will continue to operate as part of our obligation through the state.
Okay, thank you, Dr. Eccles. What I'll do is we'll go down the line here. If any members have any questions, you can explain to them. Alderwoman Spencer.
Thank you, Mr. Chair. Thank you, Dr. Eccles, for being here today. So it's my understanding that this bill that we're amending in 2008, can you help us understand how the loss of you know, how we kind of lost our status as a healthcare component designee, or,
Well, then that's the million-dollar question, right?
yes.
So,
So, I mean, what we're doing here is reinstating something that the city used to have. We used to be designated as a healthcare component, right? Or have, excuse me, as,
a cover entity, yes.
yes, entity, okay. And then that, we accidentally stripped that away or lost that.
Right, and I think the thought at the time was that because the health department wasn't billing for medical services, that we shouldn't be deemed a HIPAA cover entity, but the consideration to the other components of the public health department weren't really taken into consideration. And so I think that was just, again, a mistake to remove the health department as a HIPAA cover entity at that time.
And just so I understand the wording correctly, this is that, you know, the city being a designating, okay, so we're redesignating the city's hybrid entity healthcare components to make the city once again HIPAA compliant, or how does that actually
So
work in with the
we've continued to uphold the standards that are outlined in
in the HIPAA 1996?
Right.
Okay.
We continue to uphold those standards. However, the designation hasn't been there. And so as part of us being accountable and making sure we do our due diligence to make sure we're properly covered, reinstating the health department as a HIPAA covered entity is really important. It's critical.
So just for our basic understanding, the city of St. Louis has not been covered as HIPAA compliant.
Health department.
The health department has not been covered as a HIPAA compliant since 2008?
Right, since the amended bill was executed or put into effect.
And being designated as HIPAA compliant is necessary for federal grants and other things? Is that true, or am I?
Well, it's helpful on the grant side, but more importantly, it's really important for us to protect ourselves. So if we're adhering to the standards outlined in the act, then we are preventing ourselves from any sort of litigation and penalties from the federal government.
And given that this was erroneously done in 2008, how was this discovered within the health department?
So as the director of health, I have to pull back the layers of every piece of the health department, and so part of my due diligence was to look and see where some of the gaps were, and this was a gap that I identified. And this is something, again, that's really critical for our day-to-day operations, because we do collect information from individuals across the city of St. Louis, and also in some cases visitors. And so making sure that we're holding ourselves accountable to manage that data according to the standards that have been outlined by the federal government is really important.
Well, I have to say, given that this was kind of erroneously amended in 2008, or at least our status was erroneously eliminated at that time, that peeling back of these layers and identifying this as an issue is certainly something we needed to do, and I commend your work to make sure that we are regaining this status and making sure that we're compliant. So thank you for your service in that regard, and I have no further questions, Mr. Chairman.
Right, and it's also important, so as we look to streamline data sharing across the health system, the health departments in a lot of instances are the covered entity that kind of facilitates this data sharing. And so by reinstating us as a HIPAA covered entity when we're looking at issues such as substance misuse, violence, and so forth, it's important for us to really be in a position where we can properly convene and create a platform where data can be shared. And so without this designation, we really can't do that, because the health department wouldn't be able to serve as the covered entity under a business associates agreement.
That makes a lot of sense. Thank you again.
Thank you, Alderwoman. Alderwoman Green?
No questions.
Thank you. Alderwoman Martin?
Yes, thank you. This seems important, and I fully support it. I would just, out of curiosity, do we have a best practices for maintaining these records? Do we have, okay, are we working with the information officer on how to best protect these records? Are they cloud-based? I guess it depends on what it is.
Yes, so the standards for maintaining records that contain PHI or sensitive information are clearly outlined in the in HIPAA, and so that serves as a standard not only for our health department, for everyone, every agency, whether it's the health system, medical provider, health plan, to make sure we're properly maintaining and storing that information.
Okay, so we are not holding on to anything that would need some sort of additional security or plan as far as electronic records go?
Correct.
Okay, thank you.
Thank you, Alderwoman. Alderwoman Navarro?
Thank you. I just want to make sure that I can summarize this correctly. So in 2008, we passed a bill amending the ordinance, and when we, regarding HIPAA, and when we did that, somehow the City Health Department was left out of that bill, and then, but we didn't notice it because we weren't providing direct services?
Well, based on the amendment, the goal of, at least based on the language, the goal was to remove the health department's designation as a HIPAA-covered entity. So that was it's my understanding that was the goal, which is unfortunate.
Okay, so the purpose of that bill in 2008 was to remove the health department
Right.
from that. Okay, but we don't really have clarity on what the thinking was at
Right,
that
the
time.
individuals that were responsible for that are no longer with the agency, and it's to my knowledge, I think the legal counsel that provided guidance during that time is no longer here as well. So we really don't have the, I guess the institutional knowledge was lost.
Gotcha,
But
okay.
regardless of that, we have to, again, as I mentioned before, do our due diligence to make sure we correct some of the things that were done in the past, and so this is one way of doing that.
Gotcha, okay, great. So as the current director, you're recommending that we amend this to restore the health department?
Yes.
Okay, great, thank you. I just wanted to make sure I understood all of that, so thank you for looking this over. I appreciate your due diligence at this time. Thank you.
Thank you, Alderwoman. Alderwoman Rice.
Thank you. Thanks for the presentation and for your due diligence in getting us back on board here. My only question is, so this amends Section 3 to name the health department as one of these components, but there's some other sections that deal with privacy officers or security officers, that kind of section. Do we need to further amend those sections in order to cover the health department under those pieces of the 2008 ordinance?
We don't need to amend the other sections because listing ourselves as or designating the health department as a HIPAA-covered entity makes us liable for adhering to the guideline that's set forth in the in that act.
Okay. So we don't need to specifically outline it, but you will be putting in place a privacy officer and security officer, that kind of, as under the ordinance? Am I reading that correctly? Maybe.
So there are components, but I think multiple agencies across the city have individuals designated to do that, and so I think for the health department that will fall under the city council's office.
Okay. Okay, it might just be worth
But
a,
it's for the city at large, but
Sure.
the health department was removed from that. But the fire, if you look, the fire department, fire and EMS remained listed, and
Right.
so we typically rely on the city council's office as our.
okay. They're
Privacy
just
information
named in here under Section 5 and Section 6 for both the fire department and then the employee benefits group, both have named which entities shall serve as the privacy officers and security officers on there, so that might just be worth another look, just to make sure we're covered on that, yeah. Otherwise, no questions. Thank you so much.
Thank you. Alderman Todd.
I don't have any questions.
Thank you. And Dr. Eccles, and just to kind of follow up on Alderwoman Rice on the private security or the officer, would that do you have a city marshal that's designated up at the health department?
The city marshal.
Do city marshals, are they up there in the health department? You don't have any city marshals up there, do you? Okay. I don't have any further questions. I don't know if Mr. Schmidt has anything to add to this or not.
Our marshals are downstairs.
Yeah, that's why I was wondering if they're only just on the first floor or not, so. All right, Dr. Eccles, thank you. If no one has any more.
Just to clarify, so the marshals are on the first floor, but they aren't employees of the health department.
Right, that's what I was getting at, so. All right, if no one has any more questions, I will entertain a motion to pass Board Bill 199 out of committee with a due pass recommendation.
I move that we pass Board Bill 199 with a due pass recommendation.
It's It's been moved and seconded. Ms. Clerk, would you please call the roll?
Alderwoman Ingracia. Alderwoman Spencer.
Aye.
Alderwoman Tyus. Alderwoman Green.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd. Chairman Arnowitz.
Aye.
7 aye votes.
And if anybody wants to get on as a co-sponsor, would you please let Ms. Rogers know?
Please add me as a co-sponsor.
28.
And at this time, I'll entertain a motion to adjourn our meeting. Second? Previous row. That concludes our meeting for today, and thank you, everybody, for showing up for the committee hearing.